let's talk about barbs and molded in regards to PDO threads and specifically Nova threads. What are they and why do we use them when we come back? We've talked about PDO threads in the past, and I'll link a description below in regards to the overall education of PDO threads, how we use them, why we use them, and how they fall in line with Botox fillers and other aesthetic procedures. But today we're going to talk about some exciting news. So we have infinity threads from Nova threads. And so we're going to talk about what are infinity threads, what are molded threads, how do they fall in line with the other type of threads that we use, such as barbs, twists, and smooths. So historically, we know the barb threads, and these are the exciting new barb 5s, which we'll talk about at another time. But when it comes to infinity threads or molded threads, who can use them, why do we use them, and then when we can use them as well. So there's a couple nuances on how we use them, how we go about it. So let's talk about that today. When we do a PDO procedure, we're using all types of threads. So the ones I usually mainly in this practice, the brand name is Nova threads, but within that brand name, you have the barbs, you have the twists, and you have the smooths. So historically, when we do the treatment, we're using barbs to elevate and lift tissue or approximate tissue. Then we're using twists and smooths to blanket the face to try to build that good collagen. And that's what we use for the majority of the time when it comes to barbs. Those barbs are the workhorses in regards to when people do this to their faces in the bathroom. That's what we're trying to accomplish with barbs. The new guy on the block, the molded threads, they're similar to the barbs in that they're trying to approximate and lift tissue, but they're so much thicker and they're built in a whole different manner. So we'll cut away. I'll show you the comparisons of what moldeds are and what barbs are. As you can see here, this is what we call traditionally the barbs. And what they do is they take a dissolvable suture or a thread and they snip little chunks of it off, creating these spikes. And those are all laser cut when it comes to Nova threads. On the lower one here, this is what we're talking about today. This is the infinity molded thread. So you can see the size difference in regards to the thickness of it. And the thread is thicker, but the cannula that we place it with isn't thicker. Secondarily, you'll see spikes wrapped all around on the barbs, but on the molded thread, it's almost like they're stacking chunks of thread on top of each other to create that thicker thread. And through that thicker thread, you have longevity and you also have better pulling capacity as well. So these are the exciting new infinity molded threads. As you can tell by the side-by-side comparison, they're night and day apart. But just like any other procedure, they don't work for every single client or every single patient. So for molded threads, yes, you have a ton of lifting capacity and the tensile strength is so much more than the barbs. But because of the thickness and the way we place them, not every patient qualifies. You have to have pretty good skin thickness and healthy skin for you to tolerate that. So if you have a little bit thinner skin, then we have to use the traditional barbs. And if you have an even thinner skin beyond that, then we use thinner barbs. So that's a little bit the differences on when we can use infinity molded threads or not. Yes, we have a ton of lifting capacity, but you have to make sure you have the skin thickness and the skin health to make sure that the threads don't show when we place those molded threads all throughout. Again, we'll cut away. I'll show you how we assemble the molded threads because the barbs come pre-assembled in the packaging. So now the packaging is a little bit different now that they're the barb 5s, but they come in these individual packagings. The threads lay within the cannulas already. They've come ready to go. With the molded threads, they come in this little bit of a larger packaging because they come separated. So the first packaging will have the actual threads in them. So you can see here, the threads come separated. You then have to take the cannulas under sterile technique and build each individual. So here you'll see me open up each individual packaging and then putting it onto a sterile drape. And then these are the cannulas that I'm putting down as well, all of which have to be built under sterile conditions. So now you'll see me, I have sterile gloves on and I'm feeding the threads onto each cannula, folding over the end tip of it, and then putting on the little rubber stopper just to hold it in place. After we build each individual thread onto or into the cannulas itself, then we put back the protective casing over it, and then each molded thread is ready to go at this point. So here's a representation of how we put it into patients. So the placement is exactly the same way as we do barbs, just a little bit different because once you put in these molded threads, they're pretty much in place. Whereas barbs, you could technically take them out if you needed to, but you need quite a bit of training to make sure that you put these molds correctly. When it comes to the amount of PDO threads that I do, if you've ever seen me in Orange County or you see me in San Diego, at the San Diego facility that I work, I recently reached out to the rep and I said, hey, where do we rank in regards to how much Nova threads that we use? And he says consistently we rank in the top 3, and usually we're either 1 or 2. And that's only for me doing 80 to 90% of the PDOs. Other facilities will have anywhere from 10 to 20 providers doing PDO threads. So you can imagine how many PDO threads I'm doing on a daily basis to a monthly basis for us to rank that high in regards to doing that many PDO threads. At Orange County and Tustin, I'm curious, I haven't reached out to the rep here in regards to how many PDO threads that we do. But if you've ever traveled from LA or Arizona or even abroad from Vietnam, people that come over to see me, you can imagine how many PDO threads I do for them to seek out and try to find me. So hopefully we answer a lot of questions today in regards to barbs, in regards to the Infinity molded threads, where we're super excited to have. And then if you like the channel, of course, give it a thumbs up, subscribe, and we'll try to bring more weekly content in regards to PDO threads and all other aesthetic procedures as well.